If you have decided to get an epidural and you are in active labor, you can ask for the epidural when you are ready. Your nurse will give you fluids through your IV as your anesthesiologist is called to the room. You will also have a blood pressure cuff on your arm and a pulse oximeter on your finger, in addition to the baby monitors on your abdomen. Next, you will sit up in bed with your legs hanging from the side of the bed. Someone will hold you steady and help you get your body in the optimal position for epidural placement. The optimal position is to curl your lower back out towards the anesthesiologist. Your anesthesiologist will wear a scrub hat, mask, and sterile gloves for the epidural placement. Your lower back will be cleaned with a sterile soap. A clear plastic drape will be placed onto your back to keep the area sterile while the epidural is placed. None of this will hurt. The anesthesiologist places his or her hands on your lower back to feel the anatomy of your spine. Then, numbing medicine is used to anesthetize the skin and soft tissue where the epidural needle is eventually placed. The numbing medicine feels like a quick bee sting as it goes in, but that's it. And the injection of this local anesthetic is usually the only discomfort you may have during the epidural placement. Next, the epidural needle is inserted into the area of the skin and back that is numb. It is at this time that you should stay completely still with your back curled in the proper position. If you are having a contraction, your anesthesiologist may choose to stop advancing the needle until your contraction is complete. You may feel pressure as the epidural needle is placed into the epidural space, but you should not experience pain. Let the anesthesiologist know if anything in your back is painful. Once the epidural space is found, a small catheter is placed into the epidural space. The epidural medicine will be placed through this tiny tube. The catheter stays in the epidural space and comes out through the skin of your lower back. The catheter is secured to your back with sterile dressing and tape so that it will not come out. At this time, you can lay back down in the bed because the epidural placement is finished. A continuous infusion of medicine is connected to the epidural, and your pain relief should start in a few minutes. Your blood pressure, heart rate, and oxygen level are monitored throughout the placement of the epidural and immediately afterwards. Of course, the baby is also monitored as well. An anesthesiologist's primary goal is the safety of you and your child during labor and delivery. If you have questions or are unsure about anything, don't hesitate to ask your anesthesiologist. Hope you have a great delivery, and thanks for watching.